How many people actually are infected with COVID-19? Some researches says that most infected people have no symptoms at all. But results are controversial. For instance, researchers examined the cases of 78 patients in Wuhan, China, who tested positive for the new coronavirus and found that about 42% of those patients did not exhibit symptoms of COVID-19. According to the study, the asymptomatic patients were more likely to be women and in their 20s, 30s, or early 40s when compared with patients who did show symptoms of COVID-19. Another study, published in Thorax, researchers looked at the cases of 217 people who were on a cruise ship from Australia to Antarctica and were tested for COVID-19. While 59% of those people tested positive for the virus, only 19% of them showed symptoms of COVID-19. That means 81% of the people who tested positive for the new coronavirus were asymptomatic, NBC News reports. According to Menashemi and his team found that 45% of those who were infected with the new coronavirus reported not having any symptoms of COVID-19. Researchers at the University of Bern in Switzerland review and meta-analysis of COVID-19 literature from March to June and an analysis of 79 studies involving 6,616 people in 19 countries or territories, of whom 1,287 were classified as asymptomatic. Swiss researchers analyzed 79 studies and estimated that only 1 in 5 COVID-19 carriers show no signs of illness at all, far fewer than previously predicted. According to them, only 20% of infected develop no symptoms. An epidemiologist at the Johns Hopkins Center for Health Security said, the current best estimates for the infection fatality risk are between 0.5% and 1%, which is dramatically lower than the United States' current calculated COVID-19 case fatality rate of 5.9%. Can person with no symptoms spread COVID-19? Yes, it's possible. Even one with no symptoms may emit aerosols when they talk or breathe. This is why everyone should cover their nose and mouth when they go out in public. Coronavirus can also spread from contact with infected surfaces or objects. For example, a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes.